The shoulder joint complex is extremely susceptible. It must be mobile enough for the wide range of actions of the arms and hands, but also stable enough to allow for actions such as lifting, pushing, and pulling. The compromise between mobility and stability results in a large number of shoulder problems, namely bursitis, tendinitis, shoulder impingement syndromes, and rotator cuff tears, subluxations, separations, and dislocations. While many therapies tend to isolate shoulder biomechanics around exercise equipment, we differ. At Alliant, we are not big on raising sticks in the air or pulling color-coded rubber tubing. Instead, we focus on a primary multifaceted question: what, when, where, and how, and in some cases who, are the interferences with regard to disallowing optimal synergies of interaction within the components of the shoulder. Quite often, it's not only the shoulder itself, but variables above and below the shoulder that count. Notice for this painter that a typical shoulder circle exercise can be prescribed to no end and be reproductive of its collisions and bumps. But now notice that if an expanded thoracic cavity from an unbeknown deflated lung lobule, constrained by prior history of muscle guarding and pain, can now be facilitated to a larger surface area, such that now the circle becomes smoother and larger and less bumpy. Now the shoulder has an expanded thorax to skate on. This, in turn, can be expanded to connect the arm to the body in such a way that other areas of interference become revealed. Perhaps the orientation of the arm, the selection of certain fingers, the interplay of the wing, or the derotation of the collarbone's end at the convergence zone, or even the orientation of the head and neck. None of these variables become observed nor occur without Alliant practitioners being trained in the art of discernment of perceptible difference. Notice the change. Above all, above stretching, above strengthening, the shoulder girdle complex needs selective re-referencing of how its component parts function smoothly together as an adaptive and coordinating system, linking body and thorax to arms, and arms to a multispatial and multi-textured environment. Stop isolating your shoulder with other therapies. Connect this vulnerable region to your whole body by making an appointment with Alliant today.